Hi everyone, I want to talk about gout arthritis. Gout arthritis. Okay, gout arthritis is essentially that there's a problem with uric acid, and let's go over how we got there. Xanthine oxidase is an enzyme that will convert xanthine to uric acid. Excess uric acid will lead to hyperuricemia, and when that happens, there's possibility of deposition of uric acid in many places, including the tissues, giving us tophi, and in joints, giving us microtophi. When it is deposited in bones, it could crystallize to form monosodium urate crystals, and that is what will give us the gout. What are the possible risk factors here? There are non-modifiable risk factors like gender. It is more common in males than females. That's a good news for women. Increased age. The older you become, the more the likelihood. And of course, genetic constitution. You can do nothing about all these three factors. The modifiable risk factors. From the English word, that is self-explanatory. You can modify them. And what are these? Alcohol. Yes. The more you boost and you have genetic predisposition and you're a male and you are getting older, then don't blame anyone if you come down with gout arthritis. Meat. Yes. Many of us eat meat a lot. Could this be an advantage to vegetarians where they have what they're battling with also? Viscera, that is internal organs like kidney, the liver, the intestine, now the stomach, and so on. Seafoods, yeah, there are even some restaurants that all they sell is seafoods only, the crabs, and so on. The sardines, the shellfish, fructose, beans, sweetened foods with sugar, diuretics, because part of the side effects of diuretics is hyperuricemia. Pyrazinamide for those that have tuberculosis or Hansen's disease, that is leprosy, and Ethambutol also for those who have tuberculosis and they are on Ethambutol and pyrazinamide. Renal failure. What are the possible investigations to be done here? We can aspirate the joint for crystals. And in gout arthritis, I'm not talking about pseudo-gout. Pseudo-gout is another day entirely. But in gout arthritis, you are going to pick negative birefringence of monosodium urate crystals, and they will appear like needles. When you pick that, that is definitive. That is definitive diagnosis. You can do X-ray to know the structure of the bone, the joint there, what is going on. When you do your complete blood counts, it's likely you're going to find increased white blood cell count. Erythrocyte sedimentation rate will rise, and rheumatoid factor may be positive. What are the signs and symptoms? It's going to be acute in onset. Now, the individual would just present at the emergency room because the pain will be so sudden and excruciating. Repeatedly or only once, the pain will be very severe, like I've just mentioned, and there's going to be joint swelling. They will not be able to move the affected joint, and that is mostly found at the foot. And that's why we have what we call podagra. That is gout of the foot. And it affects first metatarsophalangeal joints of lower limbs. It will affect also the earlobe and Achilles tendons. It could be found in bursary, soft tissues, synovium, and lead to gout nephropathy. The kidney could have problem, renal failure can lead to it, and the accumulation of the uric acid can also lead to renal problem. Uric acid could be so massive that it's going to lead to uric acid calculi, leading to kidney stone, but this time around made up of uric acid. The pain can subside, but might reoccur after several days. The treatment in acute phase will involve non-steroidal anti-inflammatory drugs like Indomethacin and Colchicine. You use both in acute phase. But after then, you can apply corticosteroids intra-articular, into the joint affected, or given per oral or intramuscular. After then, you place the affected individual on prophylaxis against gout arthritis. Allopurinol is a xanthine oxidase inhibitor. Febuxostat is also xanthine oxidase inhibitor. Probenecid or sulfentrazone will all be useful here. In conclusion, kindly watch out for other arthritis like Gout arthritis, rheumatoid arthritis, and so on. Kindly subscribe to my channel so that I can get these publications immediately they are released. Thank you.